والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Welcome to the third lecture in psycholinguistics. In this lecture we are going to talk about anatomical and physiological correlates for language. What does that mean? We have anatomy and physiology and language. So how physiology and anatomy of the body or of the brain is related to language. And is language biological? I think we mentioned something like that last week. So this is what we are going to do or talk about in this lecture. So first of all, we might ask ourselves, is language really biological? Is language stored or processed in the brain? Some of you might say yes, language is biological, language is stored or processed in the brain. But some other students or other people might say no, language is not stored or processed in the brain. It might be at the heart or any other part of the body, right? In academia, in academic disciplines, we focus on evidence. We focus on evidence. Unless we have evidence that language is stored in the brain, we can't say that language is stored or processed in the brain or in any other part of the body. So here we look for evidence. What evidence do we have to support our claim that language is stored in the brain? First of all, this happened around 100 years ago. Paul Broca, someone called Paul Broca, who was a physician, a doctor, he presented the first case of what we call aphasia. What is aphasia? Aphasia is a language impairment. Language impairment. Impairment as in language does not work. All right? Deficiency in language. So language does not work. Aphasia is language impairment that is linked or caused by a brain lesion, damage in the brain. So when we have a person whose brain was damaged or had a brain lesion, and then as a result of that language was impaired, this is called aphasia. This is called aphasia. All right? So aphasia is language impairment that is linked to a brain lesion. So what happened to this person? This person, not Paul Broca. Paul Broca is the doctor. All right? So the doctor had a patient. That patient had aphasia. That patient had a brain lesion. Brain lesions as in strokes, for example. Stroke that hits the brain. So that patient had a lesion, a brain lesion, and as a result of that, that person was not able to speak fluently. So the patient was not able to speak fluently. He would repeat words, repeat sounds, and his speech was not fluent. He called him Tan. But anyways, so language was affected after the brain was damaged. So as a result of that, people said, well, this is evidence that language is stored in the brain. But what is interesting is that 10 years after that, 10 years after this case, another doctor, another physician or doctor, Carl Wernick, reported another case with another scenario. That patient spoke fluently. So that person actually had a brain lesion as well. That person had aphasia. There was damage in the brain. But that patient was able to speak fluently, but the speech, what he said, was incomprehensible. Incomprehensible. N means not, comprehend. Okay, so you cannot understand basically what that person was saying. So this was a little bit confusing because, well, we said that language is stored in the brain, and after Paul Broca's patient was unable to speak as a result of that brain lesion, that brain damage, we concluded that language is stored in the brain. But now we have another person who has a brain lesion but was able to speak, yet his speech was incomprehensible. No one could understand what that person was saying. So even though both had brain injuries, the language was affected differently. So that was confusing. So can we still say language is stored in the brain? Well, that's a confusing question. And that question leads us to talk about what we call neurolinguistics. Neurolinguistics. Neuro here refers to neurology, and here we have linguistics. So neurology and linguistics combined. What are we talking about here? It's the study of the representation of language in the brain. The representation. So, where is language represented in the body? Where is language represented in the body? Is it at the heart, at the brain, another part of the body? When you ask yourself this question, it's neurolinguistics. When you do research on that, this is neurolinguistics. So it's the study of the representation of language in the brain. In the brain. So where is language in the brain? This is called neurolinguistics. Of course, when you talk about the brain, you talk about nerves, the neural system. And language is represented in the brain. But where, how language works, this is called neurolinguistics. Sorry. All right. So first of all, we have Broca's aphasia, and then we have Wernicke's aphasia. This is pronounced as V. So Broca's aphasia and Wernicke's aphasia. For this patient, the speech was not fluent. The speech was not fluent. For some patients, they even can't speak, as we do. Wernicke's aphasia, for patients with Wernicke's aphasia, yes, they might be able to speak fluently, but the language will be incomprehensible. No one would understand what that person was saying. And now we move to look at the brain, because now more or less we are doing neurolinguistics. So we want to see the brain. Where is language represented? So is language, for example, presented here, represented here? Is language here, or is it there? Which part of the brain deals with language? All right. Okay. First of all, we have different areas of the brain. This is the first thing that we should know. So we have different areas of the brain. And each area is responsible for a particular function or job. So each part of the brain has one or two or more functions. It's the same with language. It's the same with language. There are different language functions, different language jobs, let's say. We have understanding, we have comprehension, we have memory, we have, so speech production, as in, for example, giving orders to the mouth to move in this way. This is a language function, or a function that is related to language, or to be more specific, related to speech production. You see? All right. So let's look at those areas of the brain that are relevant to what we are saying here. First of all, we have B, this area here. The area called B, okay? B stands for Broca, if you remember here. Yeah, Broca. So this area was called after this doctor, because this doctor discovered this area of the brain, let's say. All right, what he discovered is that this part of the brain is responsible for speech production. As a result of that, any damage to this area means the person will not be able, or might not be able, to produce language, to speak as we do. If this part of the brain is damaged, or if there was a lesion around that area, then the person would not be able to speak fluently, at least. So this area, B, is Broca's area. The other area, which is Wernicke, this one, which is around there. Okay, and by the way, the person, or the brain, this brain is angled in such a way that the eyes will be here looking at that direction. Right, so this is the frontal lobe. This is the front. This one is the front, and here we have the occipital lobe. So this is the back. This area here is the back. All right, so the person will be facing this way. This here will be the frontal lobe. This is the occipital lobe, so that you know what we are talking about. So the eyes will be around there. Anyways, so here we have W, which stands for Wernicke. This area is responsible for understanding, for comprehension. So a person with a brain lesion in this area might not comprehend, or might face difficulties understanding what other people are saying. They hear everything, they hear language, but they cannot process language as we do. And this area, which is continuous, by the way, A here stands for auditory system, or processing auditory system. Okay, so the ear, actually, the ear will be around there. Okay, so this will be the ear, and it's very next to it, this A here. So this area is responsible to, so whatever you hear goes directly to the area that is responsible for processing auditory information. And so you might talk to a person with Wernicke's aphasia, and they might, well, you might ask them, for example, where is your house? They might hear the word house and then think about the building, think about someone who, for example, worked in building this house, and then give you an unrelated answer to your question. Okay, so they might give you an answer that is not related to your question. It's not that they have, it's not that they are mentally retarded. No, they can hear, but they cannot process language. They have difficulty processing language. They are not crazy. in other words. So we need to be really, really careful before we judge other people. Sometimes they have difficulty understanding what you are saying, not because they are mentally retarded, no. They have problems in this area which is responsible for processing auditory information. So they might understand reading, for example, they might, but overall they have difficulty processing or comprehending language, overall. So W stands for Wernicke, A stands for auditory. Here we have M, which stands for motor control system. So your brain, or this area of the brain, controls body movement. So any movement that you make is controlled by this area. Any lesion or damage to this area will result in difficulties in movement in general. V here stands for vision, so processing visual information in general. All right, so I hope that this is clear now. This area is responsible for processing speech or for speech production. V or W, W here, Wernicke's area, is responsible for processing or for comprehension in general. A here is responsible for processing auditory information. The M here stands for motor, so this is the motor control area. Here we have V, which stands for processing visual information. Okay. Now we will see how this is related. This is really, really important because this allows you to understand how language works in the brain. And this is central to psycholinguistics and neurolinguistics. So this fact that different language functions that language functions are located in different parts of the brain is called localization. You know the word location, right? Location, which is related to this word. Location. So when we say localization, we are referring to language lateralization. This is the other word for it. So localization. So where each function is located in the brain. All right. So Broca's aphasia, just general information. Broca's aphasia is agrammatic, which means only words, no syntax, and it's not fluent. So Broca's aphasia, or people with Broca's aphasia, their language is characterized by agrammatic constructions. That is language, there's no grammar, no syntax. And of course, it's not fluent. Wernicke's aphasia, on the other hand, is incoherent and meaningless. It might be fluent, yes, but it's incoherent and meaningless. So you cannot really make sense of what the other person is saying. And again, that leads us to talk about lateralization or localization. Lateralization, when we say that language is lateralized, what does that mean? To say that language is lateralized means that language functions, what do we mean by language function? For example, we have speech production is a language function. One job, let's say. Language function. Language comprehension. Lip reading, for example. Comprehension overall, listening, speaking, writing, processing, memory. those are called language functions in general, or functions related to language. So if any of these language functions is located in one of the two hemispheres of the cerebral cortex or the brain, then this is called lateralization. So again, we have this alright, we have, let's look at it. This is the left hemisphere and the right hemisphere. This is the brain. We have right and left. So to say that, for example, speech production is here, this is called lateralization. To say that language is lateralized means language function is represented in one of the two hemispheres, either here or here. This is language lateralization. All right? So language function, speech production, for example, comprehension, processing auditory information, and so on. If one of these is located in one of the two hemispheres, right or left, of the cerebral cortex or the brain, then this is called lateralization. This is what we mean by lateralization. So we can say, for example, language is lateralized in the left hemisphere. We can say that. And we need to be careful. It's for most people, not all people. For most people, language is located or lateralized in the left hemisphere. In the left hemisphere. And that's why most people use the right hand to write. Why? Because language is in the left hemisphere. So lateralization is linked to handedness. I've just mentioned that because language is lateralized in the left hemisphere, most people use the right hand. But how is that? Some people might say, well, it should be the other way around. If language is in the left hemisphere, people should use their left hand to write. I would say, of course, most of you know this, but control of the body is contralateral. Lateral, lateralization, location. Contra means the opposite. All right? So control of the body is contralateral. What does that mean? That means the right side of the body, okay? The right side of the body, so my right hand, for example, is controlled by the left motor and sensory areas in the brain. So the right hand, the right foot, for example, is controlled by the left. Right is controlled by the left. And left is controlled by the right. Sensory, motor and sensory areas. Or the hemisphere, left hemisphere, we can say. We need to be careful here. Someone might say, the right side of the body, the right hand, controls the left hemisphere. Is that right? Correct or incorrect? It's incorrect. The right hand is controlled by the left hemisphere. We cannot say that the right hand controls the brain or the left hemisphere or the left motor and sensory areas. We cannot say that. This is incorrect. It's the other way around. It's the brain that controls the different body parts. So we need to be really careful about this. And this shows it. We have the left hemisphere and the right hemisphere, and we have the right hand or left hand or left side of the body and the right side of the body. And control is opposite, as you can see. So the right hemisphere controls the left hand. The right side of the brain, the right hemisphere, controls the left side of the body, and the other way around. The left hemisphere, all right, controls the right hand or the right side of the body. Okay, I hope this is clear. So this refers to contralateral, the concept of contralateral, which means that the right side of the body is controlled by the left, and the left side of the body is controlled by the right hemispheres or motor and sensory areas. Okay, now this leads us to another area, another interesting question as well, at least academically, of course, that when we have brain lesions, what happened to people? What happened to people who speak more than one language? What research found is that some brain lesions or brain accidents affect both languages. So both languages will be affected similarly. Some other brain lesions affect one language but not the other, which is really interesting. So someone might have an accident which is very unfortunate, but the consequences might be interesting or telling us something about how the brain works. So for example, one might have an accident or brain lesion. As a result of that, if he or she or if they speak two languages, sometimes one of the languages will be affected, the other one will not be affected, which makes you think, like, why? What's going on in the brain? All right, some other affect one language but not the other. So here, for example, one of the languages is affected, or one of the languages is affected more, okay, than the other, but sometimes one affected but the other is not affected. So this is, or this makes us think or ask questions like, why? What's going on here? One of the possible answers for this question or for this interesting finding is that we have different parts of the brain. Some scholars, some researchers say that the first language is, or let's say, depends more on some parts of the brain. Okay, so this is one. This is the first language. When we learn a second language, they say that the brain tries to find other areas for that second language. So they would say you have a different area that is responsible for the second language, lexicon. You remember we mentioned the word lexicon? Lexicon is the number of words of a language. So if, for example, this will be the Arabic lexicon, all of the Arabic words are stored here, according to some scholars. And let's say the English lexicon, or the words that you know in English, are stored there. As a result of that, if this area is affected, you will lose the first language but not the second, and so on. This is one of the arguments. I'm not saying that's the correct one, it's the only one, but this is one of the arguments, that we have areas responsible for first or second languages. Of course, some language functions are shared between the two, because they are basic language functions, like speech production, for example. And by the way, there are different parts of the brain responsible for memory. This is really important. Let me just go back to this slide. Okay, we have different parts of the body or of the brain that are responsible for memory. And to them, let's assume that it's here. We can't see it from here, but let's say it is. This is memory, okay, 1. This is memory 2. All right? This is type 1. This is type 2. To some scholars, we rely, in the first language, we rely on this area, which is, let's say, procedural, implicit knowledge, all of that. So this is procedural memory, for example. And this area here or there is responsible for what we call declarative memory. Declarative memory. It's another type of memory. So when language function, when this area is affected, the first language will be affected. But when this area is affected, this one here, then the second language will be affected. This is one of the hypotheses, according to some scholars. Right. Okay, we need to delete that. Okay. Now, this is another finding that is related to neurolinguistics, how the brain works and all of that, is split brain patients. First of all, you should know epilepsy. Epilepsy is when you have high electric voltage. You know, in the brain we have electricity, right? When we have high electric voltage traveling from the right hemisphere to the left, from the left to the right, and so on. So there is communication going on here. There are tissues linking the right hemisphere and the left hemisphere in the middle here, as you can see. Okay? When you have high electric voltage traveling from the right to the left and then hitting this area of the brain, what is going to happen? This area, M, stands for what? For motor control, for controlling movement, right? So what will happen if you have high electric voltage coming to this area? That person will not be able to control body movements and they will fall. So this is called epilepsy. Okay. Sometimes epilepsy can be really severe, really severe. Sometimes it's controllable with pills. Then people will not have too many problems. But sometimes it's uncontrollable. It's like every 2 minutes or so, or 1 minute. If it's this severe, some patients, some doctors propose cutting the corpus callosum, cutting these tissues here, linking the right and left hemispheres. So what they would do is that they will do a surgery to like make them not linked, separate, to separate the left hemisphere and the right hemisphere. Some of you might ask, what is going to happen to that person if there is no communication between the right and left hemispheres? What is going to happen? Would that person be able to walk, to talk, to live just like any other person? Well, we are going to see in a minute what's going to happen. Linguistically, we're going to focus. By the way, corpus callosum is or refers to the tissues linking the two hemispheres. So what will happen if we cut the corpus callosum and separate the two hemispheres? This is what's going to happen. Naming an object can be difficult sometimes. So what they would do, I'm going to show you an experiment right now. I'm going to show you an experiment right now, and hopefully you can follow what I'm saying. First of all, they will show the person a screen. In the middle, there is a dot. Okay? Sometimes they would show pictures or words to the right of the dot. Sometimes they would show words to the left. Let's see, and then they ask that person, what did you see? Of course, sometimes they would show them words or pictures to the right and to the left. Let's see what happens. All right, so this is the patient. This is the patient who had brain surgery. I'm going to comment on what you see here. So this is the left hemisphere and the right hemisphere, and this is the doctor that did the operation. All right, so they show that the patient some words or pictures to the right or to the left. Here to the right, and he said car. He said car. He was able to name it. Right? He was able to name whatever is shown to the right side of the screen. But what happens if they show him something to the left of the dot, like, well, forget about tree. It's the same. But what happens when they showed him a pan? He said, I didn't see anything. He said, I didn't see anything. The doctor asked him to draw what he saw with the left hand, and he was able to draw it, pan. He asked him, what did you draw? He said, pan. A few seconds ago, he said, I didn't see anything. Now they show him two things, and they asked him, what did you see? And he only was able to draw what he saw to the right of the dot, to the right side of the dot. So what is going on? You see, car. So what is going on? Why is it that this person cannot name anything that is shown to the left? Like here, saw, for example, and the hammer. The hammer was to the right, the saw to the left. They asked him, what did you see? He said, hammer. they asked him to draw with the left hand, and he drew a saw. Isn't that interesting? So he says, I saw a hammer. But they said, draw it with your left hand, and he drew a saw, as you can see. Isn't that interesting? Doesn't that tell us a lot about how the brain works? Some of you might still say, well, I didn't get it. I'm going to explain it right now, don't worry. Okay. I'm trying to find a slide. Okay. Let's use this area here. First of all, I said that this is the screen. All right. Let's say that we have right hemisphere and we have a left hemisphere. All right. This is right. This is left hemisphere, the different hemispheres of the brain. We said that control of the body is contralateral, right? What does that mean? That means what you see with your right eye goes where? To the left. What you see, let's go back to it. For example, it's there. Okay. I'd rather use this one if you don't mind, just to make it easier for you. All right. So you have. Okay. Let's say that here we have different eyes. All right. So this eye is linked to the right hemisphere, and this is linked. So the right eye is linked to the left side of the brain. The left eye is linked to the right hemisphere. As a result of that, if they show a person something to the right eye, all right, it goes where? It goes directly to the left hemisphere. And where is speech production? To the right or to the left? We said that speech production is in the left hemisphere for most people. So the information traveled from here to the right eye to the left hemisphere straight away, right? They ask this person, what did you see? And he says, well, it's that thing, car. What happened if it's the opposite? If it's something to the left, it goes to the left eye. The left eye is linked to the right hemisphere. The information is here. They ask this person, what did you see? And he says, I didn't see anything. Why? Because the information now is in the right hemisphere and cannot travel to the left hemisphere. Why? Because this area here is cut. There is no communication between the two hemispheres. Isn't that interesting? So we show a person something to the left. It goes to the left eye. The left eye is linked to the right hemisphere. The right hemisphere. We ask that person to speak about what he saw, and he says, there's nothing, because there's nothing here about what he saw there. But they asked this person to draw what he saw here. Let's say that it's a spoon, for example. They ask this person to draw with the left hand and see what happens. The information travels from here, spoon, to the left eye, and from the left eye it goes to the right hemisphere. The right controls left hand, and they ask this person, what did you draw what you saw? And he draws a spoon, for example, or a hammer, or anything with the left hand. You see how language is complicated, or how the brain is complicated. And this tells us also another thing about the unconscious mind. So this person was asked, what did you see? And he said, I didn't see anything, even though the brain knows that he saw a hammer. But he wasn't able to speak it because the information was here. The information needs to travel to the left hemisphere. The information must travel. For most people, there are tissues, so the information travels to the left, and as a result of that, we are able to speak because speech production is here. But drawing with the left hand is controlled by the right hemisphere. So anything I see with the left eye can travel to the right hemisphere, and then I can draw it with my left hand, and vice versa. It's the opposite. So if something went to the right eye, for example, to the right eye, to the left hemisphere, the left eye won't be able to draw it, and so on. I hope that this was clear to you. This gives us a lot of information about how the brain works, and how and that gives us evidence also that language is stored, or functions at least, in the brain. Because when you have problems in the brain, then you have problems with your language, and you can measure it, you can do experiments, as we saw together. I hope that you found this lecture interesting and easy to follow. If you have questions, you can always ask me in the live sessions. Please don't miss them. If you have questions, come in the live sessions and ask me. I will be there to answer your questions. Thank you very much, and see you in the coming lecture.